There we go. Hello. We're gonna give folks a chance to come in, and I'm going to promote. I just promoted Bright to a panelist, or I tried to at least. There we go. Hey, Bright. Thank you for those who were on time. We're just going to wait one more minute before we get kicked off. All right, and we see you, Bright. Thank you all. I just know with our later in the day webinars that sometimes folks are jumping from place to place. So, well, I will move us forward, and then as others join, we will. Sorry. As others join, we will welcome them in. So thank you all for joining us for this month's Be Informed session. My name is Frank Hood. I'm the director of Hep B United, which is a coalition that is based in the U.S. and is co-chaired by the Hepatitis B Foundation and the APCHO, which is the Association of Asian Pacific Community Health Organizations. We host this webinar series every other month to really just highlight a item in hepatitis B public health for a wide variety of audience. It could be clinician, community health worker, advocate, or just someone with experience living with or taking care of someone living with hepatitis B. May is Hep Awareness Month, and so for this month, we were really going to turn it over to our storytelling program. And for that, while I normally oversee our Be Informed sessions, for this month, we're going to turn it over to my colleague Michelle, who is the program manager for advocacy engagement at the foundation and oversees our storytelling program. We are on a Zoom webinar, so if you have questions, please send them in the chat or in the Q&A, and send them as you have them because they can get handled in real time, and we will collect them and make sure they get answered either throughout or during the Q&A. We are recording this, and it will be posted afterwards, and any other questions, comments, or concerns you might have during the session, please just try to chat me in the webinar chat, and I will see what I can do for you. But with all of our housekeeping kind of in order, I'm going to turn it over to my colleague, Michelle.
Yeah, thanks so much, Frank, for the introduction, and thank you so much for inviting us to this webinar today to talk about the storytelling program. So hi, everyone. My name is Michelle Liu, and I am the Advocacy Engagement Program Manager at the Hepatitis B Foundation, where I manage our storytelling program and work with storytellers and advocates from around the world. So for today, we'll focus on the power of sharing lived experience and how storytelling can help raise awareness, reduce stigma, build community, and inspire advocacy around hepatitis B. We'll hear about our storytelling initiatives, and later we'll hear directly from two of our storytellers invited here today, Bright and Patrick, about their journeys in sharing their own stories and becoming advocates themselves. So here's a quick overview of today. We'll start with why storytelling matters in public health and a brief overview of hepatitis B and its key challenges. Then I'll introduce our storytelling programs, including Just Be, Be the Voice, and Storytellers in Action. We'll also hear from our storyteller, Bright, as well as our storyteller, Patrick. We'll also explore vaccine storytelling and how narratives can help build trust and awareness around hepatitis B prevention. And then we will close out with advocacy impact examples and follow up with a Q&A and ways that you can get involved and share your own story. So before we get started, I want to invite you guys to think about a few questions. Um, do you know someone living with a chronic or invisible condition? What challenges might they face that others don't always see? And have you ever heard a story that changed the way you think about a health issue or experience? So just wanted you guys to take a moment to think about these questions before we begin, because later on they can really speak to why storytelling can be such a powerful tool in public health. So beyond individual advocacy, storytelling is a very powerful public health tool because stories help build empathy and make complex health topics and information easier to understand, and can also help inspire action, whether that's getting tested or talking to loved ones about advocating for change. They also complement traditional health education by making information more relatable and memorable. Storytelling also helps turn facts into feelings, and feelings can therefore help drive behavior. So before we move into the programs, here is a quick overview of hepatitis B globally. So there are around 300 million people worldwide who are living with chronic hepatitis B, including 2.4 million in the US. And it is often called a silent epidemic because many people don't know that they are infected. If it's left untreated, it can lead to cirrhosis and liver cancer. Behind these numbers are lived experiences, which is where storytelling can really become essential. So hepatitis B is transmitted through blood and body fluids, most commonly from mother to child at birth globally. And despite effective testing and treatment, fewer than 10% of people worldwide are diagnosed. Stigma, misinformation, and access barriers can also play a major role in these gaps. So at the Hepatitis B Foundation, we work with individuals and communities affected by hepatitis B. Our storytelling program really helps center lived experience and helps provide a platform for those living with hepatitis B to share their stories. And these stories are shared to help raise awareness, reduce stigma, inspire action, and help raise awareness and link others to care. And so here are some of the faces of our Just Be storytellers who have bravely shared their stories and helped turn their lived experience into advocacy, awareness, and hope. So at its core, Just Be is a storytelling movement that centers real people with lived experience in conversations about hepatitis B. Stories are shared through videos, written narratives, and also through storytelling workshops, often in participants' in own languages to help reach diverse communities. It was launched in 2017 through Hepatitis B Foundation, Story Center, and APCHO. And now the stories are shared through YouTube, social media, events, and partners also share them as well to help reduce stigma and increase awareness. So the Just Be campaign raises awareness and understanding of hepatitis B as a public health issue, including education around testing, vaccination, care, and treatment. A key goal is also to reduce stigma and discrimination. Because hepatitis B is often misunderstood, fear and misinformation can prevent people from getting tested or seeking care. So helping to share these personal stories really helps humanize the condition and challenge those barriers. Just Be overall really helps empower storytellers living with hepatitis B to become their own advocates in their own communities, whether that's through speaking events, education, or broader engagement efforts. So altogether, these goals really show how storytelling can be used not just for awareness, but as a tool for public health promotion, stigma reduction, and community engagement. So in the Just Be program, the Just Be workshops bring together about 6 to 8 storytellers over 3 days in a supportive, structured environment. A key component of the workshop is the story circle, where participants are able to share their experiences, listen to others, and reflect together, and kind of build that sort of trust in each other and help each other shape narratives. This process is trauma informed, voluntary, and participant led, ensuring full control over what is shared. Storytellers then move into writing, recording, and editing with support from facilitators. The stories that are shared are always consent based, and participants choose how they want to be shared and represented. By the end of the workshop, each storyteller leaves with a completed story and often the start of a larger advocacy journey. So what we've seen through Just Be is that sharing a story is often just the beginning of someone's journey. For many storytellers, once they share their lived experience, it helps open doors to something much bigger and longer term. And whether that's through continuing to speak publicly about hepatitis B, engaging in education efforts, or becoming involved in advocacy work. And so that's really where Storytellers in Action, or SIA, comes in. It is really a program designed to support storytellers beyond the initial workshop of sharing their story, and help support and continue to build these skills for our storytellers to become their own advocates. So next, we're going to look at how that journey continues and what ongoing storytelling mentorship can look like in practice. So typically, after participating in the Just Be workshop, storytellers are able to continue their journey through Storytellers in Action, SIA, which is a longer-term mentorship program. Again, it helps support storytellers as they move from sharing their lived experience to building skills in advocacy, things like public speaking and community leadership, and kind of just using their voice in a way to support others and raise awareness. And typically it is a 6-month mentorship program that was co-created by one of our own Just Be storytellers, Wendy Lowe, who is also pictured here on this slide. And it's designed to be both facilitator-led as well as co-led by our storytellers. And storytellers within the Storytellers in Action program are able to receive hands-on support to strengthen their advocacy skills, refine their storytelling, and build experience in public speaking, media engagement, and building their skills in advocacy. And so next we will hear from one of our guest speakers today, Bright, who participated in both the Just Be workshop as well as the Storytellers in Action mentorship program as a mentor. His journey really shows how storytelling can evolve into ongoing advocacy and leadership. And so some of the things that, Bright, we would be interested in hearing you speak about are things like what led you to join Just Be, and what changed after you shared your story, as well as what was your experience being a mentor in the Storytellers in Action program, and whether or not your confidence has evolved over time. If you could share a little bit about that, that would be awesome.
Sure. Thank you very much, Michelle and everyone. I appreciate the opportunity once again. I became a storyteller. This is back in 2018. That was about 4 years after my diagnosis. And for me, initially when I was diagnosed, I had no idea how I had contracted hepatitis B. And so after my diagnosis, it took me about 2 years before it really I kind of figured out or found out how I had contracted it. And it became clear that I had contracted it as through birth when I was born. And why that is so is all my siblings all have hepatitis B as well. So that became clear at that point. So once I became aware of this, and I have also became aware that hepatitis B is the impact of hepatitis B on children during pregnancy or during the birthing process was so high, I asked myself, what can I do to support or prevent other children from becoming part of these statistics? Because I found the statistic very alarming. And so I was asking myself, what can I do? So I decided to research online and see what opportunities are available. And it was through my research that I found the Hepatitis Foundation Storytelling Program. And at that point, so I was part of the second cohort of the storytelling program. Initially, when I reached out in 2017, they had already completed the first cohort. So I was told that the second cohort, they will send me an email if I'm still interested. And then, so definitely they reached out during the second cohort, and I was still interested because I still wanted to make sure that what my experience is doesn't become some another child's experience. And so that's why I became a storyteller, with the implication of, with the mindset that even if I'm able to prevent one child from becoming part of the statistics, I've done my job, and I'll be happy with that. So I became a storyteller, and the rest, as someone would say, has is history. I haven't looked back since. Uh, and then as someone about mentoring. So when I was diagnosed back in 2014, there wasn't a lot that you could find online or any kind of support system as it is today. So I did really struggle when I was diagnosed. So as time went on and I became a storyteller, I decided to offer myself as a tool to help others. If they reach out to me, I'm willing to either listen to them, help them navigate any crisis, or just listen if they need someone to listen to what they are dealing with. I'm open to listen to, because I didn't find that when I was diagnosed. And knowing what I know now, I knew if I had had someone at that time like that, some of the challenges that I face, I probably wouldn't have gone through that. And so I decided to offer myself to other storytellers, just to help them and guide them, even new patients, old patients, just guide people throughout the process. And so uh, they don't feel like they are alone. Sometimes when they say, "Oh, you are not alone," sometimes it feels empty. But I just want them to know that it's true, that they are not alone, by sharing my own experiences and what it has been, what the life living with hepatitis B has been like, with the ups, the downs, the challenges, the difficulties, and everything that comes with the disease. So that's what made me decide to help other storytellers as well.
Yeah, thank you so much, Bright, for coming on today and sharing your story and your experience going through the Just Be workshop, as well as going through the mentorship program. I think that's very impactful for other people to hear that, initially sharing your story, what that journey looks like, and then what that looks like after going through the workshop. It continues on, and you will also always continue to have these ripple effects for other people and helping them, support them. So thank you so much, Bright, for coming on today.
Thank you.
And so as part of the Just Be program, the Be the Voice campaign was a story bank that launched in 2020, built off of the success of Just Be. And this was mainly built because nearly 300 million people worldwide live with hepatitis B, but many of their stories remain to be unheard. And so Be the Voice really helps provide a platform for those to share their stories globally with me, whether those are people impacted by hepatitis B or loved ones impacted by hepatitis B. And it really helps support efforts of sharing stories worldwide, and works towards our efforts to eliminate hepatitis B by 2030. So now we will hear from our next guest speaker, Patrick, who shared his story virtually through the Be the Voice storytelling campaign. His story really shows how storytelling can build connection and advocacy across global communities. And so, Patrick, we would love to hear from you in especially why you were interested in wanting to share your story, what initially made you want to reach out to us, and the impact it has had on you, and how have you continued to engage in advocacy after sharing your story. We would love to hear from those um, points.
Thank you very much, Michelle, and thank you all for participating in this webinar. My name is Patrick Makono. I'm from Malawi, which is part of Southern Africa, a small country just there. The lake is the biggest one than the landmass, but it's there. Um, so my story is from a different perspective to say, because I think. As with all, I did not know that I have got hepatitis B, but in 2019, I got an offer to a job, and one of the things that required was actually to get tested. So I got tested, and then that's when the news was broken to me that I have hepatitis B. And so at that point, because I was like, okay, everything was fine. I didn't take a lot of worry on that. Of course, I went visited my doctor just to look at that. He had his tests, checked the liver and stuff like that. Says, oh, everything is working perfectly. So I thought, like, okay, I think we keep on visiting the doctor and see how things go. I don't think this is going to be a big issue. And I think 2 years later, that's when I actually had felt the impact of Hep B in my life, because I got a job, um, and then I traveled. But then when I visited the country, I was that was in Jordan. Um, I was refused a work permit just because of my hepatitis B status, not that I was sick or anything, but just because I had that. So that actually sort of like affected me as an individual, because I think that job was one of the highest sort of like points in my life. I really liked the job. I really liked the environment, and I think the people I was working with was perfect. But that sort of like hit me like something that I never felt. And when I was sent back, because I risked being arrested if I had said a little bit more. So actually, I had to go back. The institution made sure that I left the country before they would actually effect the arrest and deportation. So I went back. Of course, the company was good enough to continue, still allowed me to work remotely, but that was not the best time in life. So I went through some lows, ups and downs, and then it's I just felt something like in me that I needed to share, but I couldn't find a way of sharing that kind of story to anybody. And I think it was through online, just searching and the like. That's when I find actually the B Voice storytelling platform, and I shared my story that I would like to actually share with the world, just because I think sharing that kind of experience would actually also open an opportunity for advocating maybe for changing policies and the like in different countries. But I realized with advocacy, you have to have somewhere where to start. Without anybody starting something, usually you can't move. So that's why I decided to share my story. And I think the HEP B team, the B Voice team were very helpful to actually guide me on how I could actually present my story to make sure that I express how I'm feeling, but also express how we can actually go beyond that and make some advocacy campaigns that would actually bring change to policies, or just bring the story to light so that people can actually understand that. Now, when I did my story and shared it, it was sort of like a relief, because it was like a burden lifted out from me. And then I actually went and told my siblings, told my family, and I think some of them do not understand some of the changes that are happening in my career because of that. So I think people started getting a feel of like, okay, now we understand, because we thought maybe you just left the country, just left the job without anything. So that sort of like helped a little bit in terms of making sure that I was feeling okay, in terms of like I shared something with somebody. And then I think by just participating in that, also my eyes were opening also in terms of how the situation is in my country, in Malawi, in terms of Hep B, the awareness levels. So, like when I was doing a lot of research in terms of what kind of literature is available or what kind of interventions are there, I realized there's a big gap in terms of Hep B awareness. Even the treatment levels in Malawi are still on the lower side. So that also sort of like got me encouraged to say, okay, I think I need to do something as somebody who is living with Hep B, make sure that people are more aware, and then also maybe try to get people get treatment and the like, depending on what the medical professional will actually advise. And one of the things was like I looked at organizations in Malawi that are doing that kind of work, and there are very few that are actually working on hepatitis B advocacy or even any work related. Some might have it, but just as a small component within their programming. Most will be doing HIV, TB, and stuff like those, but not like prominently Hep B. So one of the things that I've been trying to do is actually to get to see if I can find other organizations that would actually take that as something that is important, that they can actually read into that. And I've been making some progress in that, but also just trying to share my story online or whenever opportunities arise, whereby I can just share how my experiences have been in terms of that. So like I've gone to two countries where I got the job and then returned home. So a little bit stressful, but then I think through sharing, I always find it like it's encouraging to talk with other people that have faced similar kind of situations. It might be different in the way they are affected, but you still know that you're not alone. There are other people that are also facing some kind of situations, and then actually you can actually by participating in that, you actually see also what others are actually doing in terms of advocacy work in their countries, in their communities to help that. So that's how I actually the story, just telling the story, helped me as an individual because it sort of like gives me that kind of a hope that as long as my story is being shared, there's it's gonna reach somebody who also understand and possibly will make a big noise enough to make sure that there are some policy changes that regards maybe issues of discrimination for people living with hepatitis B, and also in terms of access to treatment or even testing. I think that would actually improve by just sharing stories. So I think in terms of my story, that's how my story comes in, and that's how I think I've been in the voice storytelling experience and how it has actually impacted my life as an individual. And also, I think it is now starting having some impacts even within my community. I think recently I've just had an opportunity to discuss with some other local organizations to see if they can actually adapt their programming to actually include Hep B as a core component of that. And I think we are making good progress in that. And I think the next step, we are just trying to get maybe more funding into that NGO, make sure that they actually do a lot of advocacy in terms of Hep B testing and treatment. Yeah. Thank you very much.
Yeah, thank you so much, Patrick, for sharing your experiences here and sharing your experience after sharing your story. It sounds like you've made a lot of progress in terms of helping out your own community and continuing to share your story even today to help others navigate similar situations. So now I want to shift gears into another really important area where storytelling plays a very critical role, and that is through hepatitis B prevention through vaccination. So hepatitis B is a vaccine preventable disease, but despite that, we still see a lot of gaps in awareness, access, and even misinformation that can impact vaccine uptake in different communities. And one key point is the birth dose vaccine, which is very critical in preventing lifelong infection, especially in cases of mother to child transmission. And so this is where storytelling becomes very powerful. The personal narratives can help make prevention feel more relevant, not just something people hear about in clinical or statistical sense. So building on that idea of how personal stories can help shape understanding around prevention, I'd like to share one of our storytellers vaccine storytelling videos. Our storyteller, Steve here, helps highlight how lived experience can help bring meaning to hepatitis B vaccination and why prevention and messaging can be so powerful when it's grounded in real voices. And so, as you watch this, I would like to invite you guys to think about how this story connects to the broader themes that we've been discussing today surrounding awareness, community trust, and access to care.
I am a 71-year-old American, born and raised in the United States, into a family with deep Chinese immigrant roots. I have lived in many cities and states across America. At one time, I could have been your neighbor. In fact, people like me are your neighbors. By all appearances, I had a typical childhood: school, sports, summer camp, paper routes, and family road trips. Nothing about my early life suggested I was living with a lifelong virus, but I know firsthand the consequences of not being protected or vaccinated against hepatitis B as a child. I didn't learn I had chronic hepatitis B until I was 18, when the American Red Cross flagged my first blood donation. Falling through the cracks, my pediatricians and family doctors never suspected I might be infected. Until that moment, no medical professional had ever suspected I might be infected. Looking back, I likely contracted hepatitis B at birth or through close contact with infected family members, a reality that was rarely discussed or understood at the time. For decades, I felt healthy, but beneath the surface, the virus was quietly damaging my liver. Hepatitis B has been an unspoken presence in my family. A cousin, also a chronic carrier, hid his condition out of shame and died at the age of 51 from liver failure. My father was never screened. My mother, who was also a carrier, struggled deeply with the possibility that she might have passed this disease on. Living with hepatitis B means living with uncertainty. Since my 40s, I've undergone tissue biopsies, ultrasounds, and decades of antiviral treatments to keep the virus in check. Even now, I know that cirrhosis or liver cancer is a constant possibility. When my wife and I had children, exposing them became my greatest fear. At the time, infants were only vaccinated if the mother tested positive. Even though my wife was not infected, we insisted our daughter receive the hepatitis B vaccine at birth. I lived in constant anxiety, afraid of small cuts, even close contacts, still believing that I could be a source of infection in my own home. That is why I encourage parents to protect their babies from hepatitis B beginning at birth. For me, vaccination meant relief. I was grateful to know that my children were protected from something that can be passed unknowingly and can have impact to them for a lifetime. It was a simple and safe step that gave my family added peace of mind from the very beginning. My story shows that hepatitis B can be passed in ways we might not expect, and that it can have serious long-term effects. Protecting infants from hepatitis B protects families. Giving children that defense early can make all the difference.
So Steve's story really shows how personal narratives can help bring prevention to life and become part of a broader public health education advocacy. So ever since 2017, the launch of Just Be, we've created over 190 digital stories through Just Be and our global storytelling campaign, Be the Voice. These stories have been translated into more than 14 languages and represent storytellers from over 23 countries around the world. They're shared across a wide range of platforms, including webinars, conferences, social media, YouTube, and even media interviews and documentaries. And importantly, storytelling doesn't end with the workshop or the digital storytelling recording or the video. Many storytellers go on to become public health advocates and leaders in their own communities. And another really great example of storytelling in action, it comes from one of our storytellers, David, who is a Just Be storyteller. Most recently, he was featured in the PBS Medical Stories, which is an Emmy Award-winning documentary series that shares patient journeys to help inform and inspire audiences. He had participated in the Storytellers in Action mentorship program as a mentor, and shortly after that experience, he was invited to be interviewed to be part of this series. And so what this really shows is how storytelling can evolve over time from sharing a personal experience to building skills and confidence through mentorship, and then stepping into broader public platforms like national media. It's a really strong example of how lived experience can grow into ongoing advocacy and visibility in public health spaces. So thank you all again for being here today, from the Just Be program to the Be the Voice campaign, as well as the Storytellers in Action. Storytelling is really how we turn lived experience into awareness and connection and advocacy. Stories don't end when they're told. They continue to move on and help shift perspectives and help start conversations, and they help change what's possible. And so if you're interested in getting involved, with sharing your story, please scan the QR code on the slide. And if you have any questions at all, please feel free to email me at michelle.liu@hepi.org. And whether or not you are impacted by hepatitis B, hepatitis delta, or liver cancer, your story matters. And we're here to help you share it safely and powerfully. And with that, I'd love to open it up to the audience for any questions you may have for me about the storytelling program, or if you have any questions with our storytellers, Patrick and Bright, please feel free to drop it in the chat. Do we have any questions coming in, Frank?
Nope, we don't have any on the Q&A box.
All right, sounds good. Well, thank you all again for joining our Be Informed series today, and hope you all have a great rest of your day. Take care, everyone.
Thank you.
Thank you.
See you all.